Told me I could have a heart attack or stroke, and saying that heart attack, I think I could have died in that one. But yeah, everything was kind of scary when they told me that. I was freaked out, like, oh my God, life's so short.
Astros hitting coach getting emotional recalling a health scare last year that caused him to miss the first week of spring training. Doctors discovered among things he was suffering from atrial fibrillation, and he is far from alone. Former Texan star J.J. Watt made headlines last year when he announced he had AFib. He retired after this past season. But it's not just athletes, obviously. The CDC, in fact, estimates in the next 7 years, 15 million people living in the U.S. alone will have atrial fibrillation. What exactly is it? What does those symptoms look like? Dr. Khash Hematpour, an electrophysiologist with UTHealth and Memorial Hermann, is here to explain. Also has props so we can really get what's going on. Welcome to Houston's Morning Show.
Thanks, Melissa, for having me.
Of course. What is AFib? Do you want to show us what's happening so people can really get a good idea here?
Of course. I think in order to understand AFib, we need to discuss brief crash course about human heart anatomy. So as you can see in this heart model, our heart has two bottom chambers which are thick and muscular structures. These are the main engine. They really pump the blood throughout your body. Then you can see these two smaller pink areas in the top portion of the heart. These are the two top chambers. They drive the rhythm and they work as storage for blood. So on top of these, there's a system of intricate network of fibers like nerves that generate and distribute the electrical impulse. The main portion of that system is here, right up top, in the top right chamber, in the side wall of it, next to this big vein, which we call SVC. This pulse generator is called sinus node. It generates electrical impulses in a very organized and uniform fashion. Well, it's controlled by nerves that directly connect this area to the brain. So that's how our brain tells our heart, okay, now you're exercising, go faster. Now you're relaxed, so go slower. So let's put this aside. There are things, including mechanical and chemical stressors, that can damage this natural pacemaker. Well, the wide variety of things, including, for example, high blood pressure, sleep apnea, problems with the heart valves, problems with the heart muscle, coronary artery disease, and then heavy smoking, heavy alcohol, and drugs. So as a result, this sinus node starts to get rusty and be dysfunctional. Well, our heart has a very smart design. There's always a plan B. So once that fails, there are areas in the top left chamber, which I'm gonna, show it from inside of this heart model. If you can see in the top left chamber, there are 2 or 4 dots. These are 4 veins that enter this chamber, and from around those veins, some signals start to form and drive the rhythm. The problem is those segments don't have the capability of the sinus node to work in sync.
Let's talk about what those symptoms would look like if somebody has AFib.
If someone has AFib, as I was saying, so once that happens, yes, this is called AFib. AFib feels like having palpitations, chest pressure, speeding heart, heart pounding. The symptoms are a spectrum. It can be mild, like a little fatigue, a little shortness of breath, or they can be very severe, like chest pain, passing out, and not being able to breathe.
How is it treated?
So as far as treatment, the cornerstone of treatment is stroke prevention. The issue is that the blood is very thick liquid, so it has to run smoothly, constantly. If it slows down, as it does during AFib, it quickly turns into solid, which is a blood clot and can cause major problems. So the cornerstone of treatment is anyone who has intermediate to high risk for stroke, will be treated with blood thinners. Well, we calculate that risk with a score called CHADS-VASc, and you can calculate your own score by going to Google and check it out. Your physician will do that for you and determine whether or not you need to take blood thinners or not.
So obviously it's really important to find out if you have this, because you don't want to suffer one of those catastrophic problems. How easy or difficult is it to get that diagnosis of atrial fibrillation?
It can be challenging. The issue is the AFib attacks tend to be sporadic at the beginning of the disease. So you may have symptoms, they will go away. For that reason, we have developed ways to monitor heart rhythm for long term. One good thing that I have to point out are the smart gadgets. A lot of times my patients come in, they say, I have the smart gadget
like
for my heart rhythm.
Like a watch or something?
A watch or something. And sometimes they don't even know how to go through the log. So I open up their log on their cell phone or on their watch and go through it and mark up any suspicious episode for AFib.
And that gives you
can
a
be
good
really,
plan.
really helpful.
All right, good to know. Thank you for taking time for me to
My
help
pleasure,
Hermann to help us.
My pleasure.
And great demonstration. Now we totally get our hearts, don't we?